After the consent, start with the proper exposure up to the nipple and up to the groin region. So first we should start from the foot end, assess any deformity. There is abdominal distension with abdominal thoracic respiratory rate, respiration. And now we start from the hands. So in a patient of a chronic liver disease, this is a case of abdominal distension with cystitis, and there are a peripheral edema which indicate some chronic liver disease, malignancy, or maybe there is a nephrotic syndrome, or we should also rule out there is a subcongestive cardiac failure. To start from the hands, the name, any leukoplakia or any white and white nail, the half and half nail regarding the renal variant or the hypoalbuminemia. And then we can assess the interdigital area in a patient of the compromised or the immunocompromised patient. And then there is this area indicate there is a guttering or the muscle loss. And then we assess the palmar surface of the hand. Again, if we sheet here in the palmar surface, there is some palmar erythema. The center is the pale and the surrounding is the pinkish reddish in appearance. Or then we assess the thenar and the hypothenar areas. There is an atrophy of the hypothenar and the thenar area. And then important in the any deuteral contracture. So this is the area of the deuteral contracture. Similarly, in the next hand, the comparison in the nail for the leukoplakia, kynoplakia, guttering, and then we can proceed with the same. There is a pain or palmar erythema. Then we can assess about the then assess about the tremors, hepatic associated with the hepatic disease or the liver disease related tremors, which indicate the patient in the hepatic encephalopathy grade 2. Then assessment of the pulse, the rate, rhythm, and character and the vessel wall of a patient. Now, then we assess any deformities or any pigmentation on the skin of an arm and a forearm. So we can see this the skin pale texture, they are dry, and there is some pigmentation present. Now from the forehead to downward examination, any assessment of any pigmentation on the face or any deformity in the face, like a facial palsy, or there is any the plethora or the butterfly rash. नीचे देखिए. Then conjunctival congestion and for jaundice. ऊपर देखिए. For pallidness. And now we assess the neck region or the thyroid area for assessment of a thyroid. We should need a proper exposure. But in some condition, patient does not allow for a proper exposure. So the neck vein are congested in the right as well as on the left side. Then there is involvement of the using of accessory muscles of a neck. Now, the look for a spider nevi in this area. We should assess the spider nevi. So this is the area of the spider nevi. You can appreciate here. Just focus this area. This is the spider nevi. And next, we assess there is a superficial veins presence on the both sides of the abdomen with a distended abdomen. And no, there is an inverted, but this is slight inversion, which indicate there is a fluid in the abdomen. One is the characteristic features you can assess there is a fluid or the obesity by the assessment of a umbilicus. If this is the inverted, that indicate obesity, while in case of the inversion, this indicate fluid in the abdomen. And then we'll move with the dipping method to assess the liver, because this is a marked ascites in the abdomen. So this is the method, this is the dipping, one of the dipping method to assess the liver. We should start from the white mitochondrium. लंबे उस साइड पर भी लंबा सांस लीजिए. We assess the ascites, the liver. And then we mark the liver here with the pen. Just marking here is the liver. Now we assess the upper part of the liver. Start from the second intercostal space. So this is the area of the dullness, hard. So we assess the liver from here to here with a measuring tape. The next is the spleen examination. With the dipping methods, we'll move from here. With the inspiration, your hand should be inside, or with expiration, your hand outside. With inspiration, inside, or with outside. So this is a spleen. We assess the spleen, then again we slightly mark the head region and subcostal region from this to this region about the measurement of the spleen. So this is an assessment of the liver and the spleen. Now we will assess the shifting dullness. Start from the epigastric region. Now turn in this face. So this is the area of the dullness. Which side we move? But don't move your fingers. So this is the. Now wait for a few seconds and then tap. So there is a significance, the difference between. Now again. So this is the area of dullness. So shifting dullness indicate the fluids move and the area of fluid accumulation here, which shows this is the dullness. And this is the resonant area. So we can similarly on the other side. We'll move this side. This is the area of dullness. Now, happy side पे करवट ले दे. Move it, don't move the finger. Now, resonate with the significant changes. Now move again. And this is done. So the fluids move from here. So that indicate there is a shifting dullness is constant. Now, again, assess the patients. There is a fluid thing. So the fluid thing we can assess by थोड़ा सा हाथ यहाँ पे दबा लीजिए. This is the typical findings we can assess from here. There is a fluid thing. The fluid move or the sounds move on the other sides indicate there is a fluid thing.